Today we will talk about mental health tech. Focus on technological innovations in the mental health field, including online therapy, emotion recognition technology, and stress management apps. What is a mental health technician? A mental health technician is a mental health care professional who helps patients facing mental health challenges. Under the supervision of a licensed psychologist or psychiatrist in hospitals or psychiatric institutions. As a mental health technician, your responsibilities and duties include assisting the doctors in coordinating patient care, providing support to patients, such as help with daily tasks, and working to ensure a clean and safe environment for patients. You provide support with keen attention to detail and adaptability. You must also report any concerning events or behaviors to your supervisor or the patient's doctors. How to become a mental health technician? To become a mental health technician, you need a high school diploma or equivalent. Though some jobs require an associate degree in psychology or a certificate in a related field, such as CNA, Certified Nursing Assistant, training. Some mental health technician jobs only require a high school diploma and provide on-the-job training. You need to study the basics of mental health, patient care, group dynamics, and psychology to gain the skills and qualifications for this career. You can take the national certification exam given by the American Association of Psychiatric Technicians, AAPT, which may be required in some states. What is it like being a mental health technician? Working as a mental health technician can be a demanding and rewarding career choice. Mental health technicians have a lot of contact with patients and help patients participate in various therapeutic and recreational activities. They help patients with daily tasks and skills, such as hygiene and taking medications. As a mental health technician, you work in a psychiatric facility or hospital, often with the same patients over extended periods of time. It can be rewarding to see their progress and develop relationships. What do mental health technicians wear? Like most medical and healthcare professionals, mental health technicians typically wear scrubs. Scrubs are loose-fitting and comfortable cotton shirts and pants that are often provided by the hospital or facility where you work. In large hospitals, scrubs are color-coded by department. You may be required to wear protective coverings, like caps, gloves, and masks for some patients. Sturdy, comfortable, supportive footwear is also a must since you spend many hours on your feet as a mental health technician. Our organization is currently seeking a mental health technician. In this role, you will supervise patients under the direction of a registered nurse or healthcare provider. You will also assist patients with daily living activities, primarily focusing on personal hygiene tasks such as brushing their teeth and bathing. While we are willing to provide on-the-job training, we prefer candidates with some post-secondary education and their CNA credential. Applicants must complete crisis intervention and de-escalation training after being hired. 1. Track any behavioral changes in patients that may be of use to healthcare providers. 2. Chart patient observations following prescribed procedures and standards. 3. Participate in the development and implementation of patient treatment programs. 4. Maintain confidentiality of patient records. 5. Transport patients to and from appointments, clinics, laboratories and/or treatments as needed. 6. Perform initial patient evaluations to determine treatment priorities, such as taking vital signs, weight, as well as urine, stool and sputum specimens. Most of us were not taught how to understand and manage our feelings. Your emotions are not something to be ashamed of. You don't have to control your feelings. You don't have to feel shame for them. Your feelings are something to learn from and work with. To do this, you can use the feelings wheel, which is a tool invented by Dr. Gloria Wilcox to help people to understand and label their feelings. Start at the center of the wheel and identify which of the emotion families you think that you are currently feeling. Then, go out closer to the edges and see how specific you can get. Which emotion is closest to what you are feeling right now? If you're having trouble, try eliminating the ones that you know that you aren't feeling. Then, label it out loud. Say, I am feeling. Give yourself a few moments to pause and sit with this feeling. Allow yourself to notice how it feels in your body, the thoughts you are thinking, and how it changes as you're paying attention to it. Rating your anger on a scale of 1 to 5 reduces your heart rate, a measure of distress. Describing your emotions when dealing with a phobia increases your courage in facing it. Adding a label to an emotion, like that's sadness or this is fear, decreases the activity in your amygdala, which is where your fight or flight response comes from. Behavioral health technicians, also known as mental health or psychiatric technicians or aides, help doctors, nurses and other mental health professionals with the treatment of patients who have various behavioral problems, developmental disorders or mental illness. As a behavioral health technician, You will work directly with the patient to implement the treatment plan prescribed. The position involves assisting patients with activities of daily living and self-care. To improve a patient's skills, the technician provides a supportive, caring environment by encouraging positive behaviors and discouraging negative behaviors. What do you think of our video? Let me know in the comments section below. Before you go, please hit the like button and subscribe to my channel. Thanks for watching.